Hi everyone. Today I'm going to talk about cultural relationships. I've been able to be a part of two very different situations over the past couple of weeks that I thought were kind of interesting as to how people handle their family members and how they deal with the difficult decisions that need to be made and whatnot. I believe I touched on cultural diversity a couple of weeks ago, I think. So this is a little bit like that. Um, so this particular situation involves two different families. One is a family that's here from Massachusetts, Caucasian family, and the other family that I had the pleasure of dealing with was also a family that was from the Dominican Republic. So the first situation I would like to talk about is the Caucasian male that we had admitted, who was admitted to the regular medical floor, waiting for a geropsych consult the next morning. He was brought in by his daughter, who was very confrontational, very direct, was adamant that he stay here and that he needs to be admitted to the geropsych floor. Her vision for that was that she wanted him placed on the geropsych floor to then be placed into a long-term care facility after that because she did not want to deal with it. The primary complaints for this individual was that he was becoming aggressive, increased confusion, soiling his depends and sitting in it and not wanting to change it, not really wanting to do anything. So his admitting diagnosis was that he had altered mental status and he was depressed. The reports from the night shift was there was no behaviors. He was very cooperative with care. He was very happy to have somebody help him, and he slept for 12 hours. So there really wasn't any indication as to why he even needed to be admitted. And this family drove all the way up from Massachusetts to bring him to our facility. So the next morning was when he was having his geropsych consult, and the daughter had shown back up. And this was a man who they pulled from his home. Stayed with one daughter, who then decided that she couldn't handle him and moved him to another daughter's home, where she instantly put him in a hotel room because she didn't want to deal with him either. And then that's how he came to our facility. They drove him up from Mass, thinking that this would be a better place for him. So when the geropsych doctor had come in to do her consult with this particular individual, she found that there was no justification for him to be there. He's of his own person. He can make his own decisions. There was really no dementia to be seen from the tests that were done on him, which sent up some red flags for staff members. And at this particular point in time, the daughter had shown up and was very upset that the consult did not go the way that she had wanted it to, because the main plan was to have him placed from our facility into a facility around in our area, apparently. She became very confrontational with the doctors and said that we're not caring for her father, we're not doing what needs to be done, and then tried to leave with him. And the patient the whole time was like, I just want to go home, I want to get my car and I want to go home. There's no reason that I need to be here. I'm fine. I've never become aggressive. So it basically boiled down to is that the family, you could tell, just really did not want to deal with him, did not want him around anymore, which was very, very sad. And the conversation had escalated between the patient's daughter as well as the doctors and the nursing staff on during the day. So the social work department was involved, as well as our care management department, trying to find a suitable place for him instead of a hotel room where he would just be alone. And the daughter was not accepting of that. The patient said he would go wherever, depending on what it was. He was not going to qualify for assisted living, because usually people that are being signed into our unit have a guardian that looks out for them, or their DPOA has been invoked. And this is a gentleman who is able to make his own decisions. So basically what it boiled down to was the daughter really just didn't want to deal with him, and then kept contradicting herself throughout the whole conversation, and became very angry. And we ended up having to get security involved because she was yelling and starting to pick up things and kind of throw them, basically throwing a tantrum. And what I kind of noticed when this situation was happening was that, to me, it felt like a lot of displaced guilt in regards to her father, in that, she really doesn't want to deal with him, and doesn't really know what else to do. But in all actuality, I mean, the gentleman is 82 years old. Um, he probably does require some services within the home, but she wasn't willing to allow us to set that up through a Massachusetts VNA service where they live. She wasn't allowing us to do anything. She didn't want him at home anymore. She wanted to, basically told us she wanted to liquidate his assets and sell his house, but she didn't have any money for him to be placed anywhere. So that made a very difficult, made for a very difficult situation, and she ended up just taking the patient and leaving, which we ended up having our vice president of nurses come down, as well as security and a bunch of other people, trying to explain to this woman, this is how this process works. You know, at this point, it is whatever your father decides that he wants, and he decided he wanted to go home. So they ended up taking him home and back to Massachusetts. So that was kind of a sad situation, trying to, I mean, you could tell the patient's daughter was angry, frustrated, which I don't really understand why, because this is a gentleman who is able to, he's independent, he's able to do things on his own, and probably just needs to have somebody look in on him every now and then. But she clearly wasn't willing to do that and felt that he needed to be in a long-term care facility. So a lot of it, I said again, was displaced guilt, and I feel a lot of it was a monetary issue. And I think that the patient knew that, and kind of fought back with his daughter, which was interesting to see, because I don't think that that's ever happened before, because the look on her face when he kind of started talking back to her was one of shock. So that's one of the situations that was dealt with. Another one was just very interesting to see the contrast between these two different families. Another family that had come in from the Dominican Republic for this particular woman who had early onset dementia and was becoming increasingly agitated at home when she couldn't remember where she was, what was going on. So she was signed into our facility as her primary care doctor had invoked her DPOA. And the wonderful thing about this is that when a patient first gets admitted into our facility, there's an admissions meeting between the social work department, the nursing staff, as well as the geropsych doctor. And this was wonderful because the whole family was there. We're talking extended family. Everybody wanted to be a part of her care and figure out the best possible situation for her. She did suffer from some depression, which is one of the main reasons why she was there, and was coming to see one of our geropsych doctors on an outpatient basis. So this particular patient was already known to the doctor that was admitting her. So it was interesting to watch and listen to the family. And when we're at these admission meetings, we're discussing discharge planning right from the get-go, which I know sounds a little weird, but it's kind of a goal that you have to work towards when they become admitted, to try and find if they need placement, services in the home, what have you. So this particular family has decided that they don't need any long-term care placement, assisted living, anything like that. They all live in the same house. There's aunts, uncles, extended family, cousins, all of that wonderful family surrounding. And they've decided that they wanted to admit her to try and maybe tweak her meds a little bit and see if that will help. And their goal is to hang on to her for as long as they possibly can and keep her in the home. And they all, they came in with their plan. They had a shift plan in between family members as to who was going to be with her. So she always had somebody with her 24 hours a day, which was wonderful. And so we admitted this particular woman, and we don't usually allow, the geropsych is a locked unit. Visiting hours are very different from the regular hospital. They're only from 2 to 6. They're only 4 hours long. But this particular individual does not speak English, so we had allowed family members to stay. So they were coming in on a rotating schedule and caring for her and bringing her food. She didn't eat the hospital food. They cooked her food. They washed her up. So basically, the only thing that nursing staff had to do with her was to pass meds and continue their assessments and document on her. But the family was very in tune to her, very concerned for her well-being, wanted to make sure that she was able to come home if at all possible. They weren't dismissing, excuse me, they weren't dismissing the idea of a long-term care facility if it was absolutely needed and if it was something that they couldn't do at home. But this particular patient is having her meds tweaked, and then the family will take her home, and there'll be services coming into the home to check on her and to make sure that her meds are, excuse me, and that her meds are doing what they're supposed to do. And they've also assigned her a psych nurse to come in and see her a couple of times a week. So I thought that that was very interesting to be a part of that situation with that family who's very loving and devoted, and wants what's best for their family member, which they feel, and the patient had voiced that she doesn't want to be anywhere but at home, and she wants to be with those that are surround her. And of course there is that language barrier, which I think makes it a little difficult. So, and it was quite interesting to watch, because our geropsych doctor also speaks Spanish, so she was able to communicate with the patient in another language, while we had family members translating for us, which was very interesting for me, because I've never been a part of anything like that before. But the contrast between the two situations was absolutely amazing. Whereas you have this one family that kind of wants to dump their family member off, and kind of want to wash their hands of it and not deal with them, when you have this other family who their whole culture is devoted to family, and to being with them, and to making the best decisions for them, and to just kind of keeping that family unit cohesive and together. So it was a stark contrast between the two. Very sad on the first case. It was very, very hard to watch the patient's face as the daughter was talking to him, and very demeaning. Whereas the other family was very loving and kind, and, would ask the patient, are you okay with this? Is this what you want? Type of thing. Because she is lucid at times. She's got some early onset dementia, so it's just beginning, and it will get worse, and that we've explained that to the family, and they're prepared to deal with that. And we'll address each situation on an individual basis when it comes up. But again, like I said, it was quite the stark contrast in how different our cultures are, how many different cultures are in regards to how they deal with their elderly family members in the home. So yeah. So I guess my question for you would be what your thoughts and opinions on how each situation played out. I mean, it was very, very different. It was weird to have the two situations back to back, and it was great to be able to compare and contrast the two. But I guess, I don't know, my question is kind of a personal question, I guess. As far as family members go for you, is it something that, and it's kind of a hard question, is it something that you would be able to do to keep your family member in the home with you and keep them as comfortable as possible? Unless it was absolutely medically necessary to place them somewhere, would that be a difficult choice for you? I've always said that I would always keep my parents with me until the very last possible minute if I couldn't do it anymore. Because they are my parents, and they gave me life, and they allowed me to grow and do whatnot, and I feel that it's my turn to take care of them when the time comes. And not a lot of people feel that way. Clearly this one particular family did not, as the other one did. And I see it more often than not, especially at the holidays, when, family members will dump their elderly loved ones off in the emergency room, and they become a social admit, and then they end up getting placed from there because the family refuses to come and take them home. So just your thoughts, I guess, and opinions on how you feel about either situation, and what do you think that you would do as a family member if you were dealing with an elderly that had dementia. So I'm sorry I've run over and this is a little long. I hope you're all having a great week, and I will see you soon.